Hey, Dr. Fitz here with our little update from the COVID from Fitzgerald Medical and Pure Life. Thank you so much, so much for watching some of these videos. We certainly appreciate it. Look, the virus doesn't care, Republican, Democrat, Independent, it just doesn't. We just try to bring you clear-headed stuff from a medical technologist. I'm a lab rat that became a doctor. So this testing stuff is right up my alley. I got some comments. It was really kind of sad. Some of you guys saw that. No, it was really good. But this was kind of cute. Dr. Henry Gerswitch, University of Michigan Med School. That was my direct boss. Now, note to self. When you're the first person in 1985 doing DNA for crime scenes, investigations, and all that, and you need a standard on your gel, you probably shouldn't draw your own blood if you're ever trying to think about committing a crime down the road. That's my DNA. I'm going to put it down really quick because my DNA is in National Legal Lab, Life Code, Cellmark, as the standard for their gels. So my wife feels better now because I can't commit any crimes because my DNA is everywhere. So, on to the really good stuff. Listen, the antibiotic testing has been going absolutely amazingly well. We have done over 800 blood draws here at Fitztropics, and we've had 45, right around 45 positive old gold. We have a friend of ours, a relatively young man, 50s, ended up in a hospital, really good friend of the wife and her friends, who desperately needs the antibodies. We're begging anybody that has the old gold, that IgG, to please donate. The blood bank, we're having a bloodmobile come here. You can call here to see where we can get you to go to donate the antibody, because that monoclonal antibody, one donation can save up to 3 lives. So please, if you tested positive, we really need you to get involved and donate that monoclonal antibody if we can. Now, moving on to some quick numbers, some really good news that I don't hear very much on TV. All I hear are, the cases are going up. Oh my God, the cases are going up. Well, in the U.S., with our testing in Quest and LabCorp, we've had great access to testing. We've had zero trouble. The swabs are a little delayed getting some because we burned through all of our swabs. However, we've done 800 blood draws. We get those back in 24 to 48 hours. Absolutely fantastic. As I said, we've done around 120 nasal swabs. The nasal swab is for you're sick. You're acutely sick. That's the viral particle in the sinus cavity. The buccal swab is not as good because it's mostly spit. The best viral concentration for the swab is up in the sinus, and that's not really a fun test to get either. The antibody test for a few days later to show if you're getting the immunity is crucially important. That one we get back in 24 to 48 hours. And as I mentioned, we've done over 800 of those. The 45 people that are positive have all done fantastic. We've not had one of our patients wind up in the hospital. There's the Henry Ford study, which was amazing. If I direct you to the Henry Ford study, I worked at Henry Ford in Detroit in the emergency room. It was the Knife and Gun Club. It was pretty exciting. But the Henry Ford study, the whole system discussed what we talked about before. Hydroxychloroquine, zithromax, zinc. I don't have a bunch of data on the remdesivir as being as effective yet, but it doesn't matter. The most important thing is talk to your doctor about which one you might want to use if you test positive and if you have pre-existing conditions. We mentioned before Selma left us. Way to go, Selma, you're gone. We miss you very much. I hope you're listening to this. She's in Kentucky? Selma's in Kentucky. We miss her already. She did the bulk of all of that testing, and we really do miss you and wish you nothing but wonderful getting married. But the really important thing is looking at the numbers. The United States has tested over 42 million people. The next closest country is Germany, around 3.5 million. Of those, you don't think you can zero in on this, but we taught you to do this on a previous video. This was the latest stats. The total deaths were 134,843, something like that. The number of cases, 3,296,599 or something like that. So, you take the number of deaths, put that on top of the number of cases, and you will get a death rate of 4%. 4%. And I know that's bad. Any death is bad. 81% of people get better with Tylenol, Gatorade. 15% get sick, might need the medication. But 96% live. 96%. What in medicine is 96%? This is so important. And my wife reminded me, the earlier you get seen if you got symptoms, the way better off everybody's going to be. If you have that fever, cough, dry cough, please see your person that you trust to get tested and find out if you need medicine or not. 81% of people get better with Tylenol and Gatorade. 15% might need medication. That dexamethasone, that shot's been amazing. We've been using it for 25 years. A little shot of Dex takes the inflammation, that cytokine storm, out of the lung. So, really importantly, to recap, the monoclonal antibodies have been helping the people that kind of in the intensive care unit. We're talking really sick people. Maybe they waited a little too long, or for whatever reason, comorbid conditions. That monoclonal antibody from the people that have recovered the old gold from our previous videos has been absolutely miraculous. So we're begging anybody that has the old gold or tested positive for that IgG to please get involved, donate that serum, because one donation, you donate 1 pint, you donate 1 pint of that, you can save up to 3 lives. Our friend, I think, waited 2 to 3 days to get the antibodies because there wasn't enough in the blood bank. That blood, once it's donated, I'm a medical technologist, we've got to do testing on that blood. We've got to do STD testing on that blood. Let's say I'm getting my hip surgery, finally, which I hope to get. Then if I need a pint of blood, you got to do HIV, herpes, hepatitis, all the STD stuff on that blood. To get red cells, you have to get the type, right? There's 20 different red cell antigens. It's not just A, B, O. There's 20 other red cell antigens that need to be also typed. The white cells, the human lymphocytic antigens, they're way more extensive for organ donation. That's usually not applicable to blood products. On the antibodies, that's what we're really concerned about. That monoclonal antibody could help so many people right now with the number of people that are actually, coming down with the Rona, the virus. Now, with that being said, the mortality rate from our previous videos, it was up to 8%. If you recall, with some of our prior videos, it's down to 4%. You guys are doing it, being careful, washing your hands. Only the 15% of people that get sick, that end up in the hospital, that need the therapeutics or the monoclonal antibody, that can help so many people. So with treatment, the death rate continues to come down. Now that we're being able to find people, isolate them, now we have therapeutics. You discuss that with your physician or whoever you love. The hydroxychloroquine, zithromax zinc, the remdesivir, the monoclonal antibodies. The most important thing is it's an incredible team. We've had a great community and a great community outreach. We can't thank you enough for participating and helping, especially with the 800 plus blood draws, along with the nasal swabs. So God bless you. Thank you so much, and let's keep doing it.